Good afternoon. Welcome to another program here at Islamic Shura TV on our nutrition and health segments. I'm Zakaria Azar, your host. Hopefully, you're having a wonderful week and you're enjoying the holidays and you're keeping safe and sound. We wanted to discuss a few different topics that are not commonly discussed so that we can be aware of them. Lately, we have a lot of environmental toxins and environmental things. We discussed plastics and BPA on a previous show. And today we wanted to discuss the effect of metals that are around us in our lives. The sources of metals, of course, can be environmental. They come from different types of products that we use, whether they're personal products in our lives or whether they're things that are in our cars, our air conditioning units, things that we have in terms of cosmetics and self-care products we use, even the lining of our pipes and plumbing in our houses and places that we take water from. These things all have different metals that are present, and the Environmental Protection Agency has levels, certain acceptable levels to these metals, and they tell us that if you have certain amount of micrograms per deciliter, meaning that if you have a certain concentration, it's okay, and it's not harmful to your health. But we know as a society that if you do have excess metals in your body and you're consuming things that are shedding metals, specifically, for example, what we hear about a lot are, we hear about mercury poisoning, we hear about these things which are in fish from the ocean. We hear about lead poisoning in paint, in different environmental substances that people build houses with. So these things are there, and then also we have emissions from cars, from combustion engines. We have emissions. We have CO2 emissions. We have carbon emissions. We have all types of metals and chemicals that are present around us. And what we want to do also in our art, when we do painting and art, we want to make sure that we're not buying pieces of markers and paint and things like this that have those toxic metals in them. Because these things, we breathe the fumes, we touch them, and they do get transferred into our bodies in one way or another. And in order for us to get rid of these things and kind of keep it at a level that is non-toxic to us and non-harmful, we have to have awareness. Awareness is very important. A lot of people cook with different types of cookware that sheds the metals. They shed, and you notice it sometimes. If you have a cook pot or you have a pan and you're cooking your eggs or your food with it, and if it's shedding and it's coming off, then be assured that some of that is coming off in your food. So you need to get the what they call the iodized or anodized pots, which are not going to shed. It's important to do that. And they might be a little bit more expensive, but in the long run, it's better for you not to get those metals in your body. Same thing with cups and metal cups. A lot of people have these metal stainless steel cups, they call them. And you want to make sure that they're of the right quality so that they're not shedding these environmental metals, these heavy metals or lighter metals into your food products. It's always important to keep the food chain, the food products clean and away from all these metal contaminations. Some of the things that we wanted to discuss in terms of what metal does in your body, what it can cause. Obviously, it can cause radical ions, right? We've heard of radical ions being produced in the body, and any form of metal can cause that type of situation in the body, and we don't want that. We also want to make sure that we prevent organ damage. It causes organ damage in the body. And also, if it gets in the bloodstream, it could decrease cognitive functioning, meaning that your normal thinking faculties could be impaired if you have metal poisoning. And in an extreme case, it could get to the levels of affecting behavior and causing a more aggressive behavior if you have metal poisoning in the body. That can happen. And then ultimately, if it's something where it's uncontrolled metal poisoning or heavy metal poisoning in the body, it can lead to death. So it's something that we have to be aware of. And if you're someone that's been born before 1978, then definitely you've had, for example, lead exposure. And even now in the body, in the buildings, there are older buildings that have lead, and they've been utilized paint with lead in them. So before the regulations came about, especially in the U.S., if you're from another country, be assured that they used metal-based products in building products. It's very common, and there's in the U.S. and in some Western countries, there's regulations and there's been bans on lead paints and lead manufacturing in terms of building products. But in most of the Eastern world, it's still utilized. So you have exposure, and you might have a certain amount of lead in your body that causes different types of health manifestations. So that's something to actually, be concerned about. In the U.S., it's been sort of mandated for the last 30 years, where there's been regulations, and to a certain extent they've been followed, and lead has been put out of all these things. But if you've had exposure and your body has it, then you have to be aware of these things. It's still an issue, and you want to make sure that as a child, if you were exposed to lead, that you don't have these issues now. And nowadays the media will tell us, hey, it's something of the past, lead poisoning. But if you had exposure, then you can still have real consequences from lower levels of lead exposure over time or through your childhood. It's important to get assessed, and it's simple. You can do a blood test, and they'll tell you your lead levels and also your mercury and other metals. Your primary care doctor can do it. You just have to request it and make sure that they feel that it's justified. They'll ask you where you've lived and what exposure you've had. Especially if you're someone from another country, you can tell them that you've had exposure to lead as an adult and as a child, and you'd like to make sure that you don't have toxic levels in your body. They'll tell you, oh, you have low levels of lead, and that's that, and you have that little threshold amount. But lead's not supposed to be in your body. You're not supposed to have metals and like that in your body. So it is to our benefit to get rid of it. And how do we get rid of these things? Again, number one is your nutrition, and then number two is how and what you eat in terms of your nutrition, what types of foods. Again, the detoxifying foods are usually going to be your cruciferous vegetables. Cruciferous vegetables are the number one thing you can take to clarify and distill your body of all these foreign chemicals that might be there. So it's a good idea to have a regular habit of taking what we know here in the West as those green juices. The green juices that we take, they have cabbage, Brussels sprouts, broccoli, kale, these type of leafy green vegetables, you can put them in a shake with a little bit of maybe beets and things like this to make it taste better, and take a couple of glasses of that a week, and that'll help detox your body and keep you in tip-top shape form. There's also other things that people do nowadays. We do what's known as chelation therapy, where the metals of the body through an IV are absorbed. You could do chelation therapy with a chemical known as EDTA. A lot of these drip companies do it. You get IV vitamins and you get the drip. There's also IV glutathione, which is a master antioxidant, and that goes and clears up all the free radicals in the body. So glutathione is very important. A precursor to glutathione is NAC. It's a supplement that you can take. Of course, discuss it with your provider and see what they suggest for you. But those are things that you can do to decrease the effect of metals in your body, or heavy metal poisoning. If you do have a test with your provider and they see that it's a lot, they'll definitely have a protocol for you to follow, and that's something important to follow up with. But in general, if you want to maintain a control over environmental metals that might be in your body, the cruciferous vegetables regularly is very important. Typically, we're advised to take 5 to 7 servings of fruits and vegetables a day. 80% plus of the people do not do that. And it's important, if you can do that, that'll cleanse your body. And make sure you're not taking the vegetables that are exposed to pesticides, because pesticides themselves have different types of metal poisoning in them as well. So you want to make sure that they're clean vegetables, and you wash them and clean them, and then you utilize them. Or if you can afford to get the a little bit more expensive ones from like Whole Foods and from places where the vegetables are not exposed to the pesticides, they're organic and they're a little bit more wholesome, that would be the best if you can do that ideally. Those are things you can do to prevent the negative consequences from heavy metals in your body. And then also regular hydration and good water intake is important as well, because 70% of your body is water. So you want to make sure that you're not dehydrated and you don't give excess position for those heavy metals in your body to do damage. So the more water you drink, the more cruciferous vegetables you take, the better it is for your body in terms of detoxing and getting rid of foreign substances. It's very important. If you do have higher levels, then you can do chelation therapy. That's important. That's provides a good healing for environmental toxins in the body. A lot of people do that, and it's something which is not that expensive. You do it once or twice and get those things expunged from your body. That's very important to do. I think that's it for these low levels. Oh, the other thing I wanted to mention, there was a study in 2010 where they followed 10,000 patients, and they had a slightly elevated lead level, and they're all around 40-year-olds, and they found that having a lead level of 5 to 9 micrograms per deciliter was associated with increased risk of death from cardiovascular disease and cancer. So they correlated it to increased risk of death from those things if you had that type of 5 to 9 micrograms per deciliter of lead in the body. So there have been studies that have been done recently. This one was 2010. And then, of course, there's a hair test, and they test your urine as well. They can do that and for heavy metals, and that's very indicative of how your body is doing. Ideally, there shouldn't be any lead in your blood. That's very important to kind of keep in mind. Although the health agencies or environmental agencies, the EPA, they tell us, oh, you can have a certain amount in your body, it's safe. But ideally, it's not heavy metals are not a chemical that should be in your body at all. That's something that you can talk to your provider about and discuss it and try to get a grip on it if they say that you do have it. Especially if you come from foreign countries and Eastern countries, you have been exposed. So that's something where if you have certain symptoms and certain illnesses that you haven't figured out what it's from, it might be from an environmental toxin like lead or like different metals. So look into that and discuss it with your provider. Bring up the possibility so they can actually take care of you, and you have optimal health. With that, we'll see you next week on our program. Thank you for attending, and if you have any questions or concerns, please don't forget to comment and like our content. Take care. Bye bye.